The world is changing all the time, and medicine, as much as we would like to think that it's a static thing, it's actually changing constantly. COVID-19 taught us that we can't stop, we can't rest on our laurels. We always have to be thinking about the future, about new things, about new treatments, because the world will give us new diseases, and new things are going to happen all the time in the field of medicine. I'm Gretchen Arnoczy. I'm one of the infectious diseases specialists here at Moore Regional Hospital, FirstHealth of the Carolinas, and I do some work in clinical trials. So I came to FirstHealth out of fellowship from University of Chapel Hill, and when I was in training, I did work in clinical trials, and I was thinking about pursuing a career in research. But I decided my favorite part of the job was just the taking care of patients part. And so I came to FirstHealth because I really wanted to be a place that was patient-centered, thinking about the patient care. But it's interesting because then part of patient care is figuring out what works and figuring out how to make people better and which treatments are the best ones. So I think clinical trials are the best tool we have to figure out if something actually works or not. Some of the clinical trials that I've been a part of have been looking at a new antibiotic for treating urine infections. And within COVID-19, we participated in the Mayo Clinic study looking at convalescent plasma. And then we also did our own homegrown study, a seroprevalence study, where we were looking in summer of 2020 to see how many people had already had COVID and whether or not they knew it. And then we had a couple different opportunities pop up that really were amazing opportunities we couldn't say no to. One was the NIH was actually reaching out during the COVID pandemic. They had basically saturated a lot of the usual places people do research, university settings, very large systems, but there were all these trials trying to go live. And so they were reaching out for communities that didn't always participate in the bigger studies. Even though it's not something we did a lot of yet, it was a big opportunity. I really wanted to help further the science that was happening with COVID-19. And so we said, we can do this. And then we went from an exploratory email to going live and enrolling a patient within about a month, which in the world of clinical trials is pretty amazing. And then we ended up being one of the major enrollers for that study and really helped figure something out about whether or not a treatment actually worked or not. And that was a very exciting thing to be a part of. Then we actually published a paper together that talked about using smaller community hospitals as an avenue for clinical trials, and how in some ways we can be a little bit more efficient and nimble, and we can still do the good work that bigger places do, but sometimes we can do it even a little bit faster. And then that has attracted some attention of people asking us about doing the next one. Anytime you have a system that wants to be innovative, the most important part is the leadership supportive. And so having leadership that is supportive of that type of thing, who are going to reduce the barriers and clear the path for you and prioritize it, that makes it possible for you then to do the exciting, innovative things that you want to do. And that is how you move science forward. That's how we change medicine. That's how we really make sure we're doing the best thing for our patients every single time.